You know, we've had first, second, and I think we're kind of moving in towards the third generation of stents, and we're taking a look at one of the big trials, zotorolimus-eluting and paclitaxel-eluting stents in an all-comer population in China. This is the RESOLUTE China study. It's a randomized control trial, and I am with Philippe Genereaux, who is MD and director of the Angiographic Core Lab for this particular paper, which is coming out in JACC Imaging. Posts, I believe, March 21st. All right, let's talk a little bit about this. This is a Chinese study, obviously, but you headed up the core lab, correct, that looked at this?
Exactly. So we're fortunate actually to collaborate with Xubo, who is a key player in China. And we actually ran the trial as an angiographic core lab. And it's an important role because the primary endpoint was angiographic for this trial. Yeah.
And what did they look at specifically? Can you give me any details?
So the RESOLUTE China was an all-comer trial, mainly looking for a difference in weight loss as a primary endpoint, comparing the RESOLUTE, the new zotorolimus-eluting stent, compared to paclitaxel Texas drug-eluting stent. So truly a first generation comparing the second generation drug-eluting stent in all comers in Chinese. And mainly the primary endpoint, like I said, was weight loss, with secondary powerful weight loss, and secondary endpoint was a clinical endpoint, such cardiac death, MACE, target vessel revascularization, TLR, and target vessel failure and target lesion failure. The main finding of this manuscript actually is that at 9 months, the weight loss was really low in the RESOLUTE stent with 0.16, which is very low for this all-comers complex population, compared to the Texas was 0.33, and that was highly significant. So that was the primary endpoint. So the trial met the non-inferior endpoint of weight loss at 9 months.
And are there some advantages that are found in the trial when they're comparing the two stents?
So that's a very interesting manuscript that actually confirmed the safety of the RESOLUTE and the efficacy as well. The special finding of this manuscript is as all-comers study trial, that's included a lot of complex patients, CTO, STEMI, left main, and the RESOLUTE showed very good result in weight loss, in angiographic result, as well as a clinical result in this high-risk population, and the same thing in diabetic patients. So I will say that these Chinese trial extend the result that we saw with the RESOLUTE all-comers published by Dr. Sirius, and as well as the 20 trial. Yeah. And
what's the take-home message out of this?
So the take-home message actually is a good news for patients because the second generation stent are efficient and are safe. And I think that the second generation in Chinese all-comers population will be as efficient as other new DES, and new second generation DES. And compared to the Texas, actually, is outperform this platform.
I probably should mention that Dr. Genereaux is the director of the Angiographic Core Laboratory at the Cardiovascular Research Foundation. The paper is published online ahead of print March 21st. It's coming in JACC Interventions. You can look for it online or wait for it to appear in JACC Interventions. For Cardiosource World News, I'm Executive Editor Rick McGuire.